Good morning and thank you. I'm Barbara Ferrer, the Director of LA County's Department of Public Health, and I want to take a moment to express immense gratitude to our county supervisors, especially to Chair Catherine Barger and Supervisor Lindsay Horvath, as well as all our city and county partners for their extraordinary leadership and steadfast commitment during this challenging time. I also want to thank our first responders and Chief Maroney and Sheriff Luna for their bravery and tireless efforts to protect lives and property. Nevertheless, the devastation is surreal and heartbreaking. So please know that our entire public health team extends our support and healing prayers to everyone who's been affected by these devastating fires. And as we heal and we work together to rebuild lives, homes, and communities, it is important to note, as many have said, that the fires left behind significant hazards. And I want to highlight some key common sense steps that we should be taking to safeguard our health and well-being. Fire debris and ash contain harmful substances like heavy metals, asbestos, and toxic chemicals. Heavy metals, such as lead and arsenic, can come from burned electronics and building materials, and even a brief exposure can potentially cause skin irritations and lead to more serious illness. The same is true of exposure to asbestos, which we know is found in older construction materials, and it has the risk of causing severe respiratory diseases years after exposure. Additionally, some materials can produce chemicals when they burn, like polycyclic aromatic hydrocarbons, we call them PAHs, and dioxins, which everyone knows are also linked to respiratory irritation, and in some cases, they're known carcinogens. The fact that ash and fire debris likely contain these hazards highlights the importance of using protective equipment and handling debris with caution to minimize and prevent unnecessary exposure. And taking sensible precautions applies to many of us, since in the weeks to come and the weeks past, the winds continue to spread ash and soot, even in the communities that are not adjacent to the burn areas. There are a few sensible and important precautions to take if you're returning to fire-affected areas or cleaning up soot and ash at your home. If possible, consider delaying returning to burn areas until after the EPA has removed the hazardous waste products. If you are sifting through debris or you're cleaning areas that are coated with soot and ash, always wear protective gear. This includes an N95 or P100 respirator mask, gloves, long-sleeve clothing, and shoes to minimize contact with hazardous particles. Surgical masks, those blue surgical masks, and cloth masks are not effective against ash and fine particulates. Avoid cleaning methods that are going to stir up the ash. In particular, please do not use leaf blowers. Instead, use wet cleaning methods like mopping, followed by damp cleaning before you gently sweep. Ash and debris that you collect can be sealed in plastic bags for disposal to prevent re-exposure and the spread of these toxins. We know that this process is overwhelming. Public health staff and mental health staff are stationed at all of the reentry checkpoints. We have vital information and resources, including guidance on safe cleanup practices, and we have protective equipment. We're also at the disaster recovery centers with information and DPH colleagues that can try to answer all your questions. For additional support, you can contact our environmental health community line at 626-430-9821, and we'll connect you with an environmental health specialist who can assist with your questions and concerns. I know that recovery is going to take time, and I also know that we're going to navigate this together. Public health is committed to providing support and resources that are needed to stay safe and to rebuild. Thank you.